Hi, I'm Dr. Willie Dayan, and I'd like you to join me for our webinar on July 31st this summer, talking about complex cases and how we can treat our surgical cases non-surgically. Let's have a look at what we're going to talk about. So as I said, it's on July 31st, treating our surgical cases non-surgically. Now, for many years, many people can try something and say, I tried that, it doesn't work. But the real question is that true? And what I found after 25 years with aligner orthodontics, if you work it, it works. So here's a patient with a class 3 skeletal base, very asymmetric, severely crowded. How did we make a plan that can give us this occlusion with no surgery? Here's a patient with a class 2, and you can see here she has a orthognathic mandible, her incisors are proclined, lip incompetency. How is it that we created a plan with extraction of a lower incisor, reduced her face height, closed the extra vertical dimension, uprighted her incisors, and we did no surgery? Here's a patient with a class 3 open bite. We're in the middle of treatment with angel aligners. They fit perfectly. And after her first order, she's class 2 on one side, class 1 on the other side, and her open bite is closed. How did we get that done so quickly in one set of aligners? Of course, she's going to finish soon, but still, that's a lot of progress so quickly. Here, we have to upright 2 teeth where the bicuspid is missing in between them. How do we upright those teeth, close the open bite at the same time, and make her ready for good prosthetic restorations? Here's a patient with severe class 2, short face height. Certainly there are surgical options for this patient, but we treated her non-surgically with elastics and aligners, and she's ready for restorations. And finally, a patient who has a lot of facial asymmetry, class 2 on one side, class 1 on the other, with a very, very gummy smile and a long face height. She's had several consults, but we ended up reducing her gummy smile, giving her straight teeth. The midline's still off. There's a lot of camouflage. We did it in 3 sets of aligners, and we're finished in less than 2 years. Here's someone with an asymmetry and a missing upper lateral. Once again, keep the maxilla symmetrical, camouflage the asymmetry in the mandible. Let's see how that gets planned out. Finally, a patient who needs both upper and lower midlines moved in one direction, and on that side of the mouth, she has no anchorage. How did we get that job done, and how did we move the midlines across? Many people ask me, do I do braces? Do I do Damon? Do I do American? Do I do aligners? I don't ask any of these sports stars if they do Nike. And certainly if I get her guitar, I won't sound like her. So the real question is, ask not what aligners can do, but ask yourself what you can do with them. So I hope you'll join me on July 31st. Let's see how we can get these complex cases done, treating our surgical cases non-surgically. I hope to see you there, and have a great day.